Welcome to Modern Management of the Older Adult, brought to you by the Institute of Clinical Excellence.
Hey team, welcome to the MMOA podcast. I'm Macy Bolt, outpatient PT and TA with the Older Adult Division. Recently, someone near and dear to me was in an accident and ended up with a head injury, which just reminded me how important it is for us to really be optimizing recovery for these folks. So today we're going to talk about my top 5 tips for managing concussion and head injury for our patients to really help them get the most out of those early phases of recovery. We really often think of this as a condition that young athletes end up with, but our older adult patients bonk their heads more often than we usually consider, and definitely more often than they report. Just a quick kind of anecdote here, but I once had a patient come in for a gait and balance evaluation, and we were chatting through subjective information, and I always ask specifically about head trauma related to anything, but especially related to falling. This patient told me that she had had no head trauma. Then we started discussing her falls history, and she told me her most recent fall, she had fallen down a full flight of wooden basement stairs, was unconscious and alone for 30 minutes until her daughter found her, and then remembers nothing for 2 days after that, but straight up told me she had had no head trauma. Then, in further questioning, we uncovered that she had also been in a major car accident after that incident where she again hit her head. So all of this to say, sometimes you need to dig a little bit deeper with these folks in your subjective questioning to make sure that you aren't missing details that really can significantly impact your plan of care. So let's jump into the 5 tips for managing kind of that post-concussive, post-head injury patient in those early stages. Number 1 is that complete rest is not king anymore. The most updated recommendations is that light activity and specifically aerobic activity as early as tolerated is really important to optimize recovery. Blood flow is healing. And the best way that we can get really good perfusion to that healing brain tissue is to get the biggest pump in our body, which is our heart, working. So that's where aerobic activity early on and within tolerance is really important for these folks. The caveat here is that we have to be managing and monitoring symptoms and providing guideposts for these patients during those activities so that we don't cause a major flare of symptoms. So that's really key when advising on early activity. Number 2, we want to create an optimal treatment environment. So this is where I joke that you get to set the mood a little bit in the clinic space or in the treatment space that you're working within. All joking aside, this can seriously make or break the patient experience. If your workplace is like mine, we have overhead fluorescent lighting, curtain treatment rooms, which makes it kind of loud, and it's a very busy clinic, which really can flare people up when it comes to managing symptoms. So when treating someone who has just had a major head injury or even a minor head injury, think you want a spa-like setting. So dim lighting. If you don't have that option, patients can wear sunglasses during treatment initially. We want some noise, but nothing loud, jarring, banging, clanging, nothing like that. And then we want our patient to be able to be relaxed. And that is the key. There are some patients that do not prefer dim lighting, and if they relax better in a normally lit room, totally fine. Your goal is to find what works for your patient so that they can be relaxed during the treatment, because if their nervous system is ramped up, they're going to have a harder time doing what you need them to do during the session. So that's number 2. Number 3 is do not overtest or overtreat on day 1. Our first instinct on evaluation day is usually to get the whole picture and get as much information as possible. This is a population of patients that we need to be really careful about that with. I can tell you from experience, if you overtest those folks on day 1, you will not get any valuable information, because once you flare those symptoms up, every single test you do is going to come back positive, and you're going to end up having to redo everything on a subsequent visit anyway. So really make your priority list in your head or on paper even, or on a whiteboard, and prioritize those really important tests that are going to give you the most information for day one. With these folks, and really with any patient, you just need a starting point. You do not have to have the whole plan of care mapped out day one. Really having just that launch pad, that starting point is so important. And so less is more, and do not overdo it with these people. There are often cervical, vestibular, oculomotor, cognitive deficits on board after a head injury. And so not throwing everything at your patient is so key. I have done full evaluations where the only thing the patient goes home with is diaphragmatic breathing and downregulation of their nervous system to kind of take things out of overdrive and just reset a little bit. So simple is best here. You're going to get so much further faster if you take it slow at the beginning and don't overdo it that first day. So that's number 3. Number 4 is optimize nutrition, hydration, and sleep. So this is really where we get to kind of pull into our lifestyle coaching skill aspect of being rehab professionals. And we really get to hone in on fueling the patient with things that are going to help them recover efficiently and completely. Inflammation is a major player in head injury recovery, and so counseling patients on minimizing systemic inflammation through diet and water intake is really important. And when it comes to sleep, that is where our brain rests and recovers. And so we know that not only is it difficult to sleep after a head injury, but sleep quality tends to decline with age. So coaching your patients on creating a great sleep environment is really important. So that can include a cool, dark room, a quiet space with white or brown noise. Brown noise is the lifeblood of my household these days because we have a newborn. And minimizing screens and stressors for a couple of hours before sleep is really important. We can really be the best provider on planet Earth and providing the best rehab possible. But if these basic needs are not being met with nutrition and sleep, recovery is going to be more difficult. So really, come at this from all angles. Even that first day when we talked about don't test and don't overtreat, you can do some patient education on this stuff and really help them optimize what does fueling look like in those early days. And then number 5, lean on other providers and specialists. These patients need a multidisciplinary team of providers in order to address all the different components that go into head injury recovery. So I'm going to talk about just a few today, but really the opportunities for collaboration are endless with other providers. So I'm a PT. I almost always collaborate with OT and speech colleagues for kind of the ADLs, the IADLs, cognitive assessments, working through adapting, modifying, recovering function, if those things are a struggle for my patient. I also often we have a medical social worker within our healthcare system, and she is the bomb. So I often make that referral as well because they can help navigate kind of other life needs. Like, do they need someone to mow their yard while they're recovering? I live in Wisconsin. Do they need someone to come shovel snow for them? Are meals a difficult thing and they need to be connected with the local Meals on Wheels or, other life things that sometimes fall to the wayside when we're thinking about, oh my gosh, we have to get this patient recovering. Like, they also have to exist in the world too. So medical social workers are incredible for that kind of thing. And then mental health concerns really can rise to the forefront after a head injury. So making sure your patient either is connected or can get connected with counseling resources, that's really key as well. And then, of course, the medical team. So usually that's a PCP, a neurologist, maybe a clinical pharmacist to help manage medications. I find that the more open and frequent the communication is with these folks, the better my patients recover because they're being taken care of from all aspects. That being said, it can also be very, very overwhelming for them to be having this many providers. And so sometimes we have to start with just one or two of those things and eventually make sure that they receive all the resources that they need. As rehab professionals, we typically are the people with the most touch points. So I kind of see our role here as we are navigating, how do I need to triage this patient? What's the most immediate need? And then kind of make that priority list again of, okay, what's step 1, what's step 2, what's step 3? So those are my 5 tips for helping patients after a head injury kind of optimize their recovery. So number 1 was introduce aerobic exercise early to get that pump going. Number 2 is create the optimal spa-like treatment environment. Number 3, less is more. Do not overtest and overtreat. Number 4 is hone in on nutrition, hydration, and sleep to optimize fueling. And number 5 is collaborate with other providers who can help your patient to get the furthest in the most efficient way possible. Thanks for joining me today. If you want to dig in more on how to coach up some of those lifestyle modifications, dial in your treatment for your older adult patients, please join us at an upcoming live course. We will be in Bellingham, Washington, and Durango, Colorado on July 12th and 13th, Portland, Oregon, July 19th and 20th, and we have our Older Adult Summit in Littleton, Colorado coming up on July 26th and 27th. Our whole older adult team comes together for that weekend, and it is the most fun weekend of learning, collaboration. We have so much fun. So if you are considering taking the live course, now is the time. Do not miss this stuff.
Thank you for listening to the MMOA podcast. If you found this helpful, please share with someone that could benefit. And if you're looking for more practical content to help you better serve older adults, head over to www.mmoa.online, where you can learn more about our free resources, our community, continuing education courses, and our certification. Once again, that's www.mmoa.online. Thanks for listening.